Hi, I'm Nina Olson, and I'm here again talking in honor of Women's Health Month. And today we're going to be discussing pelvic organ prolapse. Want to talk about pelvic organ prolapse because it is so common and it's often not discussed. So pelvic organ prolapse, which I'll define here in a moment, but I want to tell you how prevalent it is. There's up to 28% of women that are ages 20 to 59 experience pelvic organ prolapse. And over the age 59, it's about 50% of women are having some form of pelvic organ prolapse. There's varying degrees of it, but over 50% of women over age 59 are experiencing that. So that's a ton of women. So it accounts for about 20% of women waiting for a major gynecological surgery. So it's very prevalent. Prolapse reoccurs after surgery in about 58% of women. I'll show you why that is in a moment, okay? So what exactly is pelvic organ prolapse? So this is what I wanted to pull up here because it's so much easier to show on a visual aid what exactly pelvic organ prolapse is. So prolapse is really the descent of one or more organs, internal organs, out of their normal alignment. So this is what we call a cross-section of a pelvis. So this is like if you take a person or a pelvis and you cut them right down the middle, split that open, you're seeing the cross-section from the front to the back. And we have 4 different pelvises here that we're going to talk about, okay? So you can see we have our 3 lowest internal organs, our reproductive organs, down in through here, okay? So we have our bladder with urethra, the uterus with the vaginal canal, and the rectal part of the colon, and the anal sphincter down here. Okay, so you're seeing all 3 right in a row. So if any of those move out of their normal alignment because of some sort of deficit in our system, then that is what we term pelvic organ prolapse. So let's talk about a couple of the common types. So the first type that's very common is called cystocele or bladder prolapse. So that's when the bladder, which should normally look like this, a nice vesicle with kind of a sharp bend in it with the urethra coming out. If we lose some stability of the bladder, it drops down and it pushes into the vaginal canal. So we can see here that this part of the bladder is really now kind of a breeding ground for extra urine that maybe can't make its way out of the bladder, and a breeding ground for urinary tract infections. Some common complaints of people who are dealing with bladder prolapse is that they feel that they have a hard time emptying their bladder because of it pushing into the vaginal canal. People complain that they feel a lot of heaviness or pressure in their pelvis, or they even describe they feel like they're sitting on a ball. And that ball is actually the bladder pushing into the vaginal canal. So it makes it very difficult to empty the bladder fully when we have that bladder pushing back into the vaginal canal. You can see how this urine would come right out when we wanted it to, and this is much more difficult. It also makes it so you have more leakage. So the urine that, as it comes down through here, it can just kind of trickle out much easier before it comes down here to get caught. So you can have some difficulty fully emptying, or you can even have more urinary leakage associated with this. Okay, so that is cystocele. Now we're going to move down here and talk about rectocele, okay? And what that is very similarly to the bladder prolapsing down. Now we have the rectum prolapsing down and pushing into the vaginal canal, okay? And a big thing associated with this type of pelvic organ prolapse is that there is now stool that gets stuck back here, and very much related to constipation or the feeling that maybe we're not having full emptying of our bowels, okay? Also very common to complain that there's some pressure down in the pelvis, that there's a ball down here that people feel like they're sitting on. Commonly associated with low back pain because of some of the pressures and how it's making your body kind of stand in a position that can put more pressure on your low back. So that is rectocele, okay? The third common type is uterine prolapse, and that's when the uterus itself just comes straight down, okay? And that, again, feels very like a lot of heaviness. We can feel kind of a ball or a pressure there with sitting. And it can be very, very uncomfortable for women dealing with this, okay? So, just wanted to go back to this one. So there's more research out there now that is supporting physical therapy for pelvic organ prolapse. And it used to be kind of the mindset that if our organs are coming out, that we need to have surgery just to lift them up and surgically tack them into place. And unfortunately, some of those surgeries, depending on what was used, like certain types of meshes, have not been that great for people. Sometimes there's complications associated with that, and patients have to go back in to have it reconstructed or some of that mesh taken out. But now, through research, we're finding that physical therapy can be really helpful in reducing the symptoms of pelvic organ prolapse for patients. And the reason is because when we look at our internal organs here, one of the main jobs of our pelvic floor muscles, which is, if you remember from our last talk, the sling of muscles that runs from the pubic bone to the tailbone, they have a big job of supporting the internal organs, okay? So they are really, when they're nice and contracted and they have good strength, they do a really good job supporting the internal organs, all right? So you can see that if we have these things falling inward, that if we build some strength of the pelvic floor, we can actually lift and support the internal organs and reduce the symptoms of pelvic organ prolapse. So unfortunately, the surgeries that I just mentioned, there is a recurrence of 58% of cases that the organs then re-prolapse again. And I've seen this a lot where patients have a surgery, they have everything tacked up, and a few years later, the internal organs now again are falling back downward. And I'm starting to see that some surgeons are referring to physical therapy for prehab and rehab of the pelvic floor, both before and after these surgical interventions are done, which is just wonderful. And I'll show you why. So if we think about the boat being your pelvic organs, so we have, let's say this is your bladder, and your bladder is kind of being pulled downward, okay? And we say, oh, your bladder is being pulled downward. Let's tack that up, surgically lift it up, and we're going to tie it off around these stabilizing pieces here, okay? So if we're using the boat analogy, these would be like posts that we would anchor the boat to. Or in your pelvis, this would be your pubic bone, okay? So we're lifting and we're tacking that up. The problem is that because of the pelvic floor, if we just tack that up and we don't do anything to the pelvic floor, and we have a weak pelvic floor, and this is the water level way down here, okay? If we had a strong pelvic floor that was really lifted and supported and could help support this boat, we would have a much more successful outcome. So just thinking through the analogy. So if we do this and we tack this up, and over time we don't change anything else about what the patient's doing, how they're moving, how they're using their abdominals, how they're using their pelvic floor, you can see that over time these structures here are probably going to give way and stretch down. as we can see in 58% of cases they do. So often now we're finding that if we can get some more support of our pelvic floor to help support not only here where we've surgically intervened, but now up here to provide upward pressure to those internal organs, the patient's much more happy and has more successful outcomes. So even patients who have come in that did not have any physical therapy and they have surgery and they come in to me and they say, I had this surgery 5 years ago and now it worked really well, but now things are falling back down again. And they enter physical therapy at that point in time, we can bring support up here and have a significant reduction of their symptoms. And I've seen this happen in the clinic many times. So research is still going on. Randomized controlled trials are still happening to help support what I'm saying. But I've seen it anecdotally in the clinic that if we support from here, we have a much happier patient with reduced symptoms. So that's my spiel on pelvic organ prolapse. Don't hesitate to reach out to one of us here at Freedom Physical Therapy if you have questions about what I spoke about today. Thanks.